Now, we aren't talking about getting home from an airport. CAB, or CAB, actually stands for compression, airway, breathing. It is the sequence of actions to take when performing CPR. Chest compressions are the most important part of CPR. By starting with compressions, you immediately begin circulating oxygen and avoid the delays involved in opening the airway and giving breaths. Although the CAB sequence is the same for adults, children, and infants, some of the techniques are different. Now let's identify the techniques of each of the CAB steps for an adult victim. Ensure the scene is safe and put on gloves. Tap the victim on the shoulder. Shout, "Are you all right?" Check for a response such as eyes opening, moaning, or movement. If no response, call for help. If a bystander is available, send them to call 911 and get an AED if one is available. If you're alone, call 911 and get the AED yourself. Scan the chest looking for normal breathing. If there is no breathing or only gasping, begin the CAB sequence starting with immediate chest compressions. Provide 30 compressions. The rescuer should be in a kneeling position at the victim's side. Place hands in the center of the chest between the nipples. The heel of one hand is on the chest and the other hand is on top of the first. Extend or interlace fingers to keep them off the chest. The rescuer's shoulders are directly over their hands. The thrust of each compression should be straight down. Rescuer's arms should be as straight as possible. Use the body weight, not arm strength, to achieve proper depth. Compress at least 2 inches. Give at least 100 compressions per minute. Allow full chest expansion between each compression. After 30 compressions, quickly open the airway for rescue breaths. Use the head tilt chin lift maneuver to open the airway. When an unresponsive person is laying flat on their back, the tongue relaxes and blocks the passage of air. Tilting the head and lifting the chin moves the tongue out of the way. Place one hand on the victim's forehead and apply firm, backward pressure with your palm, tilting the head back. Place 2 or 3 fingers of your other hand on the jaw near the chin. Tilt the head back while lifting the chin upward. Do not press deep into the soft tissue under the chin. After the airway is open, give 2 rescue breaths for 1 second each breath. Provide just enough air to see a visible chest rise. Avoid overventilation. If you give breaths that are too hard or too fast, it may cause vomiting and reduce cardiac output. It should take no more than 10 seconds to give 2 rescue breaths and resume compressions. Provide cycles of 30 compressions followed by 2 rescue breaths. Compressions are tiring. Even the fittest rescuers fatigue quickly. If another trained rescuer is available, have them take over CPR about every 2 minutes or while the AED is analyzing. In the workplace, you will be expected to use a barrier device. With your family, you may choose to perform mouth-to-mouth rescue breathing. Maintain an open airway with the head tilt chin lift. Pinch the victim's nose. Inhale a regular-sized breath. Cover the victim's mouth with yours. Breathe into the victim's mouth approximately 1 second. Watch for chest rise. Lift your mouth off the victim's mouth. Repeat for a second breath. Immediately resume compressions. If the chest won't rise with the first rescue breath, allow the head to drop back down and reopen the airway. Try only once. Proceed to chest compressions.